Welcome. What I'd like to do is show you a short video detailing how we treat the abdomen with radiofrequency, and in this case specifically Thermage. So what you see here is we connect the patient to the device using a grounding pad. We always place it in the same place on the lower back. We do the same for the face, sometimes modified if patients have had a hip replacement or other form of metal object implanted. Here what we do now, the patient is obviously lying on her back. The area to be treated is being cleansed with alcohol. It's hard to see the individual wrinkles and things we're going to treat because she's on her back. But essentially what we're going to do is treat this entire lower abdomen. After cleansing the area with alcohol, we give it a minute or so essentially to dry, because if the area is too wet, then it becomes difficult to put on what you're going to see here, which are these temporary tattoos, which is an important part of the process because it essentially is your roadmap for treatment. Some physicians or clinicians prefer, prior to placing this grid on, to mark the patient with them standing, oftentimes with a red Sharpie, just to outline what we want to accomplish. In this case, it was relatively clear that we were going to treat most of the lower abdomen, so markings were unnecessary. What you see now is our nurse is taking alcohol, which has been placed on this gauze pad, and again, not too much alcohol to make it soaking or dripping wet, but enough just to get it to the point where it can be transferred to this tattoo paper. And again, the proper combination of the amount of alcohol is important to make sure, as you see here, that the tattoo goes on clean without any sort of smudging or running. And then there's a variety of things you can do with this tattoo paper. You can create your own patterns in a way that allows you to adjust treatments to settings or designs or strategies that you may feel work better in your hands. But the tattoo paper is helpful in creating the roadmap. And again, this is temporary. It's removed after the treatment very easily with alcohol-soaked gauze. And then there are things that you can do. So for example here, trying to get down to the lower abdomen rather than using multiple pieces of paper or using the entire paper to then overlap to what's already been transferred. You'll see that what our nurse is doing is using a portion of the paper to basically augment what she's already done. And then once that gets peeled off, she can then use the unused portion of that tattoo paper to fill in. And again, these are just some subtleties, and the importance of this can't be understated or even overstated because it's very important to make sure that you're treating the entire zone that you want to. And then what you'll see in a minute is that these tattoo markings become basically an outline for your strategy in terms of where you're going to place your pulses and how many you're going to place and the kind of overlap that you're going to get. So what you see now, this is the treatment tip that's being removed from the packaging. We tend to use what's now called the Thermage Total Tip, which is this orange tip, for both our abdomen and our face treatments. The total tip has proven to be very effective in terms of its ability to treat a variety of skin thicknesses and to achieve tightening on multiple surfaces, both face and abdomen, as well as other areas of the body. So you can see the tip has been placed into the handpiece. There are 900 pulses, which shows on the screen. But the first step is to tune the device to the patient. And during this step, the machine is taking various readings about primarily impedance from the patient's skin and overall circuit or system. You see that some of the gel that's supplied by Solta is placed on the skin first. We always use the gel that's supplied with the tip because it's been tuned to work best in terms of its consistency and also the ability for it to allow the machine to get its feedback without any kind of interruption from the gel itself. So you see that the machine has been set here to 2.5 on the scale of 1 going up. 2.5 is our usual starting setting. Here you see the gel being placed. Some clinicians go above 2.5. We will go as high as 3 on our machine. All machines are slightly different. But going significantly above that can increase the risk of both surface burns as well as depressions from fat atrophy. So most of our patients are treated anywhere from 0.5 to 2.5 or 3 at the most. And if you need to go a little bit above 3 because your machine is slightly different, that is okay. But with the multiple pass low fluence technique, it turns out that there's really no need to go much above that. Here the machine is now set at 2.5. The vibration is set at 1. This is the newest CPT or Comfort Pulse Technology device. Most of our patients, about 90%, prefer to have the vibration on. About 10% of our patients actually don't like the vibration, specifically on the face. And so we just turn off the vibration, and they still are actually very comfortable with the treatment. So here what you see is our nurse is treating inside what we call the squares. So the first pass will be to cover this entire grid inside the squares. The next pass after this has been filled in our practice will be to go on the circles, and you can see that there are little small circles at the intersections of each of the squares. So the second pass, we will center the tip over those circles. And then a third pass is usually done where we center it over one of either the horizontal or vertical bars that are in between the squares. And so that comes into this basically squares, circles, bars, and that gets you 3 passes over the treatment surface area. After the 3 passes are done, at this point, you can freehand or do what you need to cover the treatment area and what you want to get done in as detailed a method as possible, whether it's repeat passes or focusing in a certain area. And essentially that's the treatment. 900 pulses to the lower abdomen helps to take care of the majority of patients' laxity when you carefully select your patients. Thank you very much. I hope you have found this video to be enjoyable and educational.